So one of the speakers today at the Islamic Medical Association convention is Dr. Saalisu Ismail from Nigeria, and he'll be talking to us about his presentation today.
Okay. Assalamu alaikum warahmatullahi wabarakatuh. As you introduced, I'm a cardiothoracic surgeon. My name is Dr. Saalisu Ismail. I came from Nigeria, and I am going to present on the topic access to cardiac intervention services in low-income communities, the challenges. Yes, in other words, I'm going to present on the challenges of accessing cardiac services in low-income communities. And this actually is as a result of what we observed going on in most of the low-income countries, their ability to access any form of intervention for cardiac diseases that needed either surgery or coronary angioplasty or cardiac or percutaneous cardiac intervention. So these services actually is grossly deficient in the low-income communities, especially in the West African sub-region, and of course with other neighboring states of Central Africa and East Africa. So we are going to present on these challenges. And another observation is that most of these communities are majority Muslim-dominated communities. So we need to do something on it. From what we have found out, actually, in a community with over 70 million population, in our findings, they only have two functional cath lab. Cath lab means cardiac catheterization laboratory. And these two functional cardiac catheterization laboratory, is only in the private hospitals. In this community with over 70 million population, there is no single government functional cardiac catheterization laboratory. And from what the World Health Organization required, for every 1 million population, you need to get one cath lab. So look at it. It's over 70 million, only two. So this is for cardiac catheterization laboratory. Cardiac catheterization laboratory is a facility where you can quickly do some intervention to save life, especially when there is heart attack. Sudden collapse, somebody has heart attack, myocardial infarctions, you need to quickly go and do something. So this is what the cath lab is providing. And when such cardiac attack happens, within the next 60 minutes, you need to take your patient to that cath lab, and within 90 minutes, you should be able to do something. So look at it. That is 1.5 hours you need to take your patient there. But unfortunately, these services are not available. Where you needed up to 70 million cath labs, you are only struggling with only two. And these two are privately owned. When we come to cardiac surgery, patients are there, children with congenital heart diseases, many. And from our findings, we found that, out of 155 patients, indigent patients that urgently needed this intervention of cardiac surgery, only 3 among them will have the money to go and pay elsewhere to get operation done. So all these 152 patients are there waiting, looking for where can they get help. So in this community with over 70 million population, we also found out only three, tertiary centers can provide open heart surgery services. Only 3. And these 3 cardiac centers, they are not doing this cardiac surgery as a regular activity. It's only when you organize a mission program, you invite experts, they come and join the local team, you do these missions to support patients. So that is when you can operate on those centers. Only 3. These over 70 million people. And from 2019 till 2024, we were only able to organize 6 cardiac surgery missions and only 1 cardiac catheterization mission outside the region, because in the region there is no any cath lab. owned by the government where you can do such interventions. So, and this region, over 95% of these 70 million people are Muslims. Over 95% of them. So this is quite a big challenge, especially for me as a cardiothoracic surgeon who operate on the heart, the lungs, and the blood vessels. We are very few in the community, and we really need to get something done. So this is what we found out over the last, 2019 to 2024, only for cardiac missions. So we have to mobilize our local team. We invite other experts to come and join us. Above all, most important, is the financing. Because even if we organize this, without financing, these patients cannot afford it. The patients cannot afford it because the average cost for this intervention, cardiac surgery, is about 10,000 US dollars. 10,000 US dollars. And most of these patients cannot even afford 500 US dollars. Talking of 10,000. So most of them will remain like that. When it is their time, they will go. And they will be battling with so many difficulties. If they were children, they will be out of school. If they were adults, they cannot perform any function in the community. So this is what we found out. And of course, we started looking for what will be the way out. And this is what I am presenting in this conference. And of course, what we decided as members of the Federation of Islamic Medical Association, FEMA, we have what we call the FEMA Safe Heart. I am the one leading this project, and we are looking around to see what can we do to make access to cardiac intervention easy in these communities. So that is why we brought these findings and why we come to present, so that we can think with our Muslim community, how can we come to support these types of community. This is only one I gave you example. There are so many other communities like that. And of course, what we are trying to do is to establish a center. And this center, we call it FEMA Safe Heart Center. And this Safe Heart Center will provide the cardiac intervention services in these low-income communities, especially this index community we are talking about, was over 70 million, majority Muslims, 95% of them Muslims, and they are battling with cardiac diseases that they cannot be helped. And this center is planned to provide the cardiac surgery services, cardiac catheterization services, diagnostic services, therapeutics and awareness, and of course training services, both short-term, medium, and long-term training. This is our plan for this center, and of course we have gone far in our effort. Already we have a competent local team involving the cardiothoracic surgeons, the cardiac anesthetics, the cardiologists, both adult and pediatric cardiologists. We have hematologists, we have perioperative nurses, we have critical and intensive care nurses, we have physiotherapists, we have some other supporting staff. And this group of people are always ready when we are doing such intervention to help patients. They always come out. So we already formed this local team, and under the Federation of Islamic Medical Association, we have so many other experts in cardiac surgery and cardiology who are also interested in joining this. We have been discussing with them over the past 4 or 5 years about this project. So we have cardiologists, we have cardiac surgeons, we have so many others. So we have gotten this strength, and the next is to get a center. Already we have discussed with the government of Jigawa State under the leadership of His Excellency Malam Umar Namadi, who is the governor of Jigawa State, and they developed interest in partnering with FEMA Safe Heart to establish this center in Jigawa State. And he accepted it. He also invited me to the council of Jigawa State so that we can discuss this. We presented to the council, and almost all the members of the council accepted the project. They supported it, and they now put commitment, to establish the structure. So we are here to, inform them about the development, and of course, how can they also network with us so that we can equip this center and of course provide the services that is quite needed. If this center is established, it's going to be the only center of this kind in the West Africa, Central Africa, East Africa, if not in the whole Africa. A center that will provide cardiac intervention services on a humanitarian basis. Because previously the only center I know was one center in Sudan, established by Italians. If an indigent patient who cannot afford to pay for services can take himself or herself there, this center will provide the services for these patients free. Do you get it? But now the situation, the crisis going on in Sudan, we cannot access such services. So I couldn't find any center similar to this in West Africa, in Central Africa, in East Africa, in South Africa as well. So if we were able to push for this project, this is going to be one of the centers that will provide these services accessible and affordable for most of our indigent patients.
MashaAllah, that is Dr. Saalisu Ismail chatting to us at the IMA conference.